Yeah, it's from 3 until 7.
Oh, okay.
Oops, for me.
Yeah.
I think that's everybody.
Okay, I figure we might as well get everybody back here. All right, we'll take you guys all the way around. So this is kind of our treatment area back here where, this is where we perform our dental cleanings, on dogs' teeth and everything. Just general treatments, draw blood, that sort of thing back here. Kind of show you over here our surgery area. This is what we call our surgery suite. It's kind of crowded, but everybody can come in. It's okay. So this is actually where we perform all our surgeries. Here. And you can come on in. Dogs may not like this area too much. So you can look from out there too. So this is our surgery area, our main surgery table. We have all these very bright lights so that we can see everything during surgery. If you can see over here is one of our anesthesia machines that we use a gas called isoflurane, which is a very safe gas for anesthesia. And these green lines that you can see right here, those are where the oxygen comes from that comes out so that the dogs and cats are breathing pure oxygen when they're under anesthesia to keep them safe. So here's another one of our anesthesia machines. And we actually have the capability of performing 2 surgeries at one time in here. So if we needed to, we usually don't do that. But got a nice size area, and we try to keep this room as clean and sterile as possible so that during the procedures, everybody's safe for no infection, basically.
You've been in there, haven't you?
Yeah, that's what I say. The dogs and cats are not going to be too thrilled with this room, but
She had a hernia
oh,
operation in here.
just yes, was it Monday?
No.
Oh, a while ago. Okay.
A while ago.
Yeah. So I'll kind of, you guys, everybody want to file out? I'll show you some of the other areas of the hospital here. All right. It's okay, Isis. You don't have to stay in here today. So like I said, our treatment area, cleaning room to do everything, and then this room right in there is kind of leave you guys over here. This room right in here is our radiology room. This is where we actually take all our x-rays. The dog. So this is our x-ray table here. Kind of see, so our x-ray table, and then we will actually develop the x-rays right over here. And then when we're done, you guys can see this is just an example of an x-ray right here that basically everybody can kind of come in and look at that. It's an x-ray of a cat. So we just use those to try to find any problems, determine why animals are having maybe vomiting, trouble breathing, different disorders like that. So that's our radiology room, and then this is our, kind of show you guys over here, this is our doctor's office, doctor's station. That's where Dr. Stouter and I have our office basically. And the nice thing is this is our ICU, which is where all of our surgery patients go. So this is where they will wake up from surgery. This is where all our sick animals are, that are maybe on IV fluids or, getting a lot of medications. Maybe we're watching their breathing real closely. So the nice thing is, as you can see, there's actually glass right here so we can watch everything that's going on there at all times. They're not, away from us very far. So that's the nice thing. We keep them very close to us so we can make sure everything's healthy. And then back there, I won't take us back there, but that's our ward. That's where we keep kind of the boarding dogs, or maybe some of our cats before we put them out for adoption, basically. That's where they go. And then I'm sure you guys have been in a couple of our exam rooms, but I'll kind of show you some of those. We have basically 2 exam rooms for dogs and 2 exam rooms for cats, and then we have 1 general purpose exam room. So this is an example of one of our exam rooms for dogs. And like I said, I think a lot of you have been in here before, but you can go ahead and take a look, and then I'll show you the difference between a cat exam room here. Shut this door so everybody can get by. And actually, as we're walking through there, if you notice on this side, which will be everybody's right, this is our laboratory area. This is where this machine right here is actually our blood machine. In our hospital, we have capability of getting blood results within about 15 minutes, which is really nice. We can actually determine, if a dog or cat is sick, we can actually determine why very quickly. We don't have to send the blood out to a lab to wait a day or two, to find out what's going on. And then we have 2 microscopes. Look at different, in case a dog has a mass or a cat has a mass, we can look at that, the cells in the mass. We can look at our fecal samples here. Just about everything. So 2 microscopes there. And I'll kind of walk you down. Now these are our cat rooms. They're a little smaller, and as you can kind of see here, I'll show you those. You guys are welcome to walk in if you'd like. So these are our cat rooms, basically. And like I said, just different instruments in them, different, different treats for the cats, different brochures, just all the different information that we need for all our cat patients. And then as you guys could probably see, this is actually our cat wards here. And these are where our stray cats or our kittens will be, and then also some boarding cats will stay in here also. And this is the same window that you guys probably saw when you were outside. It kind of it looks all the way through there, so more than welcome to look in there. You can go in there, absolutely, sure. And then these are just our offices, Dr. Roberts' office, and then Sharon, our office manager's office right there.
No cats?
They're in there. There's the kittens, the stray kittens there, and I think there's the one little boarding cat right here. So.
Okay. Okay.
And the kittens are up for adoption, so anybody that's looking for a cat, they're very sweet. Yeah. And I can walk you guys past our grooming area. I don't know if you've had any of your dogs groomed there before. Okay, great, yeah. I'm going to walk you guys past the grooming area here. So it's kind of a little bit further, but as you can see, you'll pass by the dog exam rooms again. Oh, this is one last thing I didn't show you. This is our pharmacy. This is where we actually keep all of our, I don't know if I can swing this door around, but as you walk by, you'll notice this is our pharmacy where we keep all of our medications. We actually hand select basically the medications that we feel are most needed, for our dog and cat patients, and our heartworm preventive, flea and tick medications. So as you can see, we have quite a bit of medications in here, basically so that you don't have to wait to get your medication, get them right away, so the dogs and cats will get better. Right. All right. So kind of go back here again, pass by our ICU area. And then this is, you may have noticed when you came in, everybody catch up. When everybody came in, actually, there was a room that had food in it. That's our largest exam room for real big dogs, or when we have multiple, like 2 or 3 dogs coming in at one time, or sometimes 2 or 3 cats coming in at one time. We'll use that exam room. And I don't know if I can get in through there because the door may be blocked from the food. But I'll walk you guys past here. And you can kind of see our grooming area. And like I said, bear with me, this sometimes has a lot of hair on the floor and everything. Everybody's welcome to filter on in here. So this is, we usually have 2 full-time groomers, here at all times. And as you probably saw when you walked in again, there's a window that you can actually watch your dog or cat being groomed. So this is where Dawn, Kelly, and Nicole, our 3 groomers, will actually work. And they're wonderful. They groom everybody's dogs here also. So yeah, but very nice. I mean, like I said, they always welcome everybody to watch when your dog's being groomed. So it's kind of nice little deal there for everybody. And that's it. And then they just stay here. We don't use heated dryers. We just have cool air dryers, to prevent any risk of overheating while they're here. And like I said, they're right in front of the groomers, so they can watch them throughout the day too with everything. And that's about it. And then as you pass by, this goes our lunchroom, nothing special. That's for the staff and that's about it. Here, anybody have any questions or questions about any of the areas I showed you? Oh, absolutely. Yeah.